Hi everybody and welcome back to my vlog. So, first things first and get them out of the way. I know I have a black eye, you don't have to worry about me. My little girl clumped me with her tennis racket. Accidentally, of course. She's not a psychopath in the making, as far as I know. And no, I've not managed to get to the hairdressers yet, but soon, very soon. Anyway, today I've decided to talk about tear troughs and fillers, because tear troughs and fillers are probably the most common thing that I get asked about that aren't necessarily needed for the problem that the patient has. So what do I mean by that? So quite often I have women presenting in their late 30s, 40s, and they come in saying, you know, my tear troughs, this area here, is getting deep and I want you to put filler in there. And they are right, of course, that there does seem to be a line appearing here, and the natural reaction to that is that you just put filler straight in there and it lifts it out and everything will be fine. Now, we can do that and I will come to that, but more often than not we can approach it in another way, and the other way is safer, because obviously you want to stay as far away from the eye as you possibly can, because as I've mentioned previously in other vlogs, you know, it's kind of a danger area around here. There's not a lot of space and there are arteries and other vessels which run in there that you don't want to be blocking with filler. So it's important to only do something if the benefits outweigh the risks. So what I do is I have a look at the face, and what normally happens as we age is we start life with this beautiful triangular face like this, where all of the fat, the good fat that we want, is all up here and we look nice and plump and we look young. As we get older, everything starts to move down. It's really depressing, and we end up with a triangular face this way, where all the fat is vanishing from here and moving down. And as it moves down, it causes these nasolabial folds, jowls, and it also leaves behind gaps up here. So you quite often see these tear trough lines here and the lines across the cheeks where the fat is moving away from the ligaments and leaving them behind. So when I see somebody about tear troughs, I assess that first to try and work out exactly what's going on. Is it just a genetic problem and they've always had these hollows under the eyes since they were 16, in which case we might go into the tear trough? Or is it that they're aging naturally, as we all do, and all of the fat pads in the cheeks are moving down? And if the latter is the case, which more often than not is the case, what we can actually do is, before we think about the tear troughs, is think about the midface and think about supporting the tear trough from underneath. And I know that sounds really weird, but it does work well. And if you have a look on the Instagram, you'll see some examples of this. So instead of actually putting filler directly into here, we actually start thinking about replacing the filler that's moved away from these malar fat pads, that's what they're called, and moved downwards. And in doing that, we actually achieve lots. So we support the tear trough underneath here. So first of all, we put some filler just underneath the tear trough to push it up and support it. We put some filler into the midface here, and in doing that, we get rid of that line that's developed there along that sulcus, and we also return the plumpness. Now, when I say that, don't panic, because the sentence that I hear most often is, oh please, I don't want to look like a chipmunk. You won't. All we're doing here is putting back what you had, not giving you extra plump cheeks. So all we're doing is restoring that fullness in the cheeks. And it's that fullness, that plumpness in the cheeks there, which is actually the sign of youth. And if you think about it, if you look at young women, they actually have nice full mid faces, which looks fresh and youthful. And so that's what we're doing. And we can do that in two ways, and I do it in two ways. Sometimes I use a cannula. I did some last night in the clinic and I used a cannula where I actually just go up from here, under there, and just place the filler across here and into here. And the beauty of a cannula obviously is that it's less likely to pierce vessels, less likely to cause bruising or trauma. Sometimes I use a needle, however, and I'm still a great fan of the needle in the right location. And sometimes when I just want to support the tear trough underneath, I use a needle, because I can go down with the needle directly onto the top of that bone and place little tiny bits of filler under here just to support that tear trough, and it works really well. You can get more bruising with a needle, and so it's important, A, that it's in the right hands, a good practitioner, and B, you discuss with the patient the risks of bruising so that they know that it can happen, because you need to manage expectations, but also so that if they've got something really important that they're doing in the next few days, and a bruise would really be problematic for that, you know, if they're filming vlogs and they have a black eye, for example, then don't do it then, reschedule it. So that's really important. And the interesting thing about that is it actually, just supporting the tear trough can work really, really well. But let's say that's not the case. Let's say that you have got an issue where we've done all the supporting here, or you don't need any support in the midface, and it really is your tear trough that's the problem. So yeah, yes, of course, we go in to the tear trough. And again, we do it either with a cannula or a needle, but more often than not with the actual tear trough itself, I will use a cannula for safety. And it's really important that the filler goes in deep down on the bone. And the reason I say that is because A, we know there are not vessels in that location, and B, there's not much space here between the bone and the skin. There's very little fat, very little space to put the filler in. So if your practitioner goes in too superficially, puts that filler too close to the skin, two things are going to happen. So one, you might get what's called a Tyndall effect, and that's where the light reflects through the skin from the filler because it's too close to the surface and back, and you get a blue discoloration. And you quite often see people that have got this blue discoloration, and that's no good. Who wants that? And also, if you don't place it deep enough, you're going to get these bumps, and they really get accentuated when you smile. So when you smile, you then see the sausage of filler that's been put there. So that's why it's really important that you put it in the right place. It's also important on the day when your practitioner does a tear trough that they don't overfill. So by that I mean it's really tempting on the night to actually get it perfect and really lift out that tear trough. The problem with that is it's perfect when you leave the clinic, but over the next couple of days, fillers will actually attract water. That's what they do. And in so doing, they will swell a bit more. So your perfect filler on the day will turn into a bump 3 days later. So again, it's important to understand as a patient that your practitioner, if they're doing it right, won't get it absolutely perfect on the night. There will still be a hollow. And then if they've judged it absolutely correctly, over the next few days, it will lift out beautifully. So that's really important as well. Can they do it with a needle? Yes, of course, because sometimes you feel that you need that. And again, it's about tiny amounts, very deep onto the bone with a needle. There's more chance of bruising. There's more chance of hitting other vessels. So, you know, again, it's about being in skilled hands who can make the right judgment for you and them knowing what they're doing and what the anatomy is. But the next question I'm asked is, will my dark circles go away? So the answer is yes or no, we don't know. So a lot of the dark circles that you see in the tear trough are actually just shadow, where the sunken in area hollow under the eye is actually causing a shadow. And I have seen beautiful cases, and they're probably on IG again, where got dark circle beforehand, you lift out the tear trough and the dark circle is gone. However, some are genetic hyperpigmentation, and if it is genetic hyperpigmentation, then no, you're not going to get rid of it by lifting out the tear trough. It's going to look better because you haven't got that hollow making it worse, but then it won't go away. But there are other solutions for that hyperpigmentation and those dark circles that aren't fillers, and I'm going to talk about those in the coming weeks, so watch this space. It's something very new that I'm introducing to the clinic. So, in summary, tear troughs, tricky area, needs to be done by somebody who really knows what they're doing and are skilled and have done lots before. Ask them, how many have you done? Is this something you do all the time? They should assess you properly, and quite often they should be telling you that you don't need the tear trough, not because they can't do it, but because you actually need your midface addressing first. and that quite often sorts the problem. But then if they do need to do the tear trough, and sometimes we do, then they should ideally use a cannula, although a needle is not out of the question. They should be going deep onto the bone, and they should not be aiming for perfection on the night, because it will get better. So, I hope that's a whistle-stop tour around tear troughs, but it's been useful. If you've got any questions at all, just ask. Ask on the Instagram page or ask after this vlog, and I will answer them always. And I will be back soon with another video on something hopefully of interest to you. We're still on fillers at the moment, but don't worry, we are going to move on to other treatments. But there's so many things you can do with fillers. And let's hope soon that we all get a haircut and a holiday. So take care everybody, look after yourselves, and thanks for watching.